David Kessler was head of the Food and Drug Administration from 1990 to 1997. Dr. Kessler, how historic do you think this legislation is?
It is very historic, Katie. It's a landmark piece of legislation. For the first time, we have the opportunity to regulate this deadly addictive product.
Opponents of this bill, namely Republican Senator Richard Burr, say that the FDA isn't the right agency to regulate tobacco. Instead, it should be the Department of Health and Human Services. What's wrong with that idea?
FDA is a scientific regulatory agency. It's the most important consumer protection agency in the world. It regulates everything else that comes in contact with the body, all the food we eat, all the drugs we take. I mean, why shouldn't it regulate this deadly addictive product? It is well equipped to handle a scientific regulatory question.
What about cigarette smoking in general, Dr. Kessler? Hasn't that been declining in recent years? Can you just give us an update on cigarette consumption in this country?
We've made substantial improvements in the number of people who smoke. This has been, so far, a very good public health message and story. The social acceptability, how we view this product. We used to view this product as something that was glamorous, as something that was cool, as something that was sexy. Now we view this product for what it is, a deadly addictive product. But we can go one step further today, Katie. We can view this product as a nicotine delivery system. And we have not yet viewed the product that way. This is a product that is a drug delivery system. That's what this legislation says.
Does it bother you that this legislation doesn't allow the FDA to demand that nicotine levels in cigarettes be reduced?
It does allow the FDA to reduce the level of nicotine in cigarettes. It just doesn't allow the FDA to eliminate nicotine entirely. So it doesn't allow the FDA to ban cigarettes. But my sense, over the next decade or two, this product will look very differently. The world in which the tobacco companies will live will change because of this legislation.
How so?
I think the advertising, the promotion, the product itself, all will change. You know, we viewed, certainly when we were growing up, this product was associated with cowboys. It was associated with glamour. We will now have the tools to regulate the advertising and promotion and sale of the product, and hopefully also to be able to put steps in place that makes this product less addicted if we scientifically can come up with the answers. It is a dramatic set of regulatory tools.
How can you make cigarettes less addictive? In other words, is there a way to replace nicotine with something else that makes the cigarettes less habit-forming?
You know, it's not just nicotine that contributes to the addictive properties. Sure, that's the key. That's, you know, at the very core of the addictive nature of cigarettes. But it's also the other stimuli. It's the smoke. It's the color of the pack. It's the emotional gloss of advertising. Add all that up, and you take nicotine, which is a reinforcing chemical, and you end up with a deadly addictive product. And this allows FDA to regulate all aspects of this cigarette. So my hope is that we can reduce the appeal, the pull of cigarettes, and most importantly, prevent young people from starting, but also help people who are addicted, help them with cessation from smoking.
Do you think that this regulation, Dr. Kessler, will allow the level of nicotine to be reduced to a point where it is less habit-forming? Because, I mean, they basically get people to become addicted to this product. And nicotine, while the other things obviously have some influence, but that is, in fact, the key.
There are certain things that we can do today that reduces the number of people who smoke. In fact, the regulation that we signed a decade ago goes into effect when the president signs this bill because it's been put on hold up until the passage of this bill. So there are things with regard to the advertising and promotion and the sale to young people that can be put into place. We need to get more science. It is possible that by reducing the nicotine content in cigarettes, that we can reduce the number of people who are hooked. But we need more science. We need more information before we put those measures into place. We just don't know today how to do that. But my sense is with this law is going to be good not just for the next several years. This law is going to have a dramatic effect on the tobacco industry for decades to come.
And finally, as a public health advocate and as someone who's recently written a book about brain chemistry and food addictions, what other areas do you believe the FDA should become involved in terms of improving public health in this country?
You just raised the issue, of food and obesity. We've put fat, sugar, and salt on every corner. It's available 24/7. It is acceptable to eat any time of day. We walk into restaurants and we don't even know what we're eating or how many calories are in the food. So I think government has a role. Now that we know that the food industry is literally hijacking the brains of millions of Americans, I think government has a role for greater education and greater disclosure. We've done it with tobacco. It's a great day for public health, but there are other challenges ahead.
Dr. David Kessler, former head of the FDA, thanks so much for talking with us.
Thank you, Katie.